Recording. Okay, Dr. Kiriakidis, thank you so much for giving me some more of your time, because I know you're being so busy in clinic today. Thank you.
Thank you, Sarah, for the opportunity of being here today.
I wanted to pick your brains today about a topic that isn't hugely discussed, secondary infertility. And it's a topic that sometimes isn't discussed because a lot of women almost feel ashamed to come forwards and talk about this disorder, because they feel guilty because they already have a child, so they feel they can't come forwards. Can you just explain to me what is secondary infertility, and why would a woman who is conceived naturally struggle?
Well, secondary infertility is not a very common issue, actually, and that's probably why many people do not know about it. It is basically the situation where a couple has already given birth to a child. They have a child through a natural conception. They have been trying for a second child for more than 1 year, and they're not successful. So it's not that common. The fact is, though, that there are some hidden secrets with secondary infertility. Women do not suffer from secondary infertility if they have achieved their first child through IVF. So trying for a second child without IVF when your first one was born through IVF is not secondary infertility, okay? This is a misconception.
Hang on, let me get that straight. So if you did have IVF, are you saying if you had IVF, then it's not secondary infertility?
No, it's not secondary infertility. It doesn't mean that the problem that initially was there has changed, okay? So if you had a problem trying for the first time and you achieved your goal through IVF, it doesn't mean that the second time it's going to be much easier for you to have a natural conception, okay?
Okay, got it.
So the main problem causing secondary infertility is actually the same factors that apply to primary infertility, but as they evolve through time, okay? So a woman that has conceived naturally doesn't mean that she remains the same through the years, okay? People age, which means that ovaries may age, eggs may age, numbers of eggs may be reduced along the way. So something that was not present 5 years ago doesn't mean that it is not present now, okay? The same factors of infertility apply with secondary problems. So there could be a tubal problem that has come up. There could be a male problem that has come up. There could be an ovarian problem or some new uterine problem that has risen, such as a fibroid, a new fibroid that causes the whole problem. So when we're dealing with secondary infertility, we need a thorough re-evaluation, okay? The situation may have changed.
And how long should you leave it before you get tested? So if you've had your child and then you're, a couple of years down the line, you decide you want to get pregnant again and you can't, how quickly should you, or how long should you wait until you come and see you?
Well, the women that already have children should get pregnant in a year of trying. So 1 year should be the maximum amount of time to wait before you visit a fertility specialist. However, it's not the same when we're dealing with a young couple that got pregnant when they were 25 and now they're trying 3 years later to get pregnant and they cannot succeed. They can wait for 1 year. If this same couple is 40 years old, you cannot wait for 1 year, obviously. You need to visit a doctor sooner. Around 3 to 6 months of trying is enough.
Oh, wow.
If you cannot achieve your goal by 6 months and you are over 40, you need to visit a fertility specialist.
Yes. Yeah. Right. So you really do have to like act quite quickly then, so that that window closes. And so,
Age is a very important factor.
yes. And so what is the, so if a couple comes to you and so it's been 6 months, they can't conceive, but tests show that there isn't anything wrong, is that then described as unexplained infertility, or is that still secondary infertility, or is it both?
It's actually both. It's actually both. Sometimes your body can do all the right things, but you cannot get pregnant. That's the problem. That's the frustrating aspect of unexplained infertility. You cannot see the problem. Okay. Uh, what is needed is a very detailed screening, because sometimes the problem is underlying, it's not apparent to us. Okay, so let's say, for example, let's give an example. A woman conceives naturally. She has a fine pregnancy, but she delivers by C-section. Okay, a C-section in itself can be the problem. All the rest, the anatomy of the area may look the same, the tubes may work fine, but the fact that this woman had a C-section has changed the microarchitecture of the uterus, okay? And you need to focus on that to help this woman. So sometimes it is unexplained infertility, but sometimes explanations may come through the IVF program. You know, sometimes IVF is a diagnostic procedure. Okay.
Like I was just saying before, there is we don't have enough women coming to us. You know, all the other infertility causes, we get emails all the time. But like I said, there is a sense of guilt with women suffering with secondary infertility because they feel that they can't, you know, they can't be upset because they are already mothers. Do you get many women, couples coming to you with secondary infertility?
We have several couples that come back for the second child. The fact that you mentioned now is very, very interesting, because sometimes women are relieved because they have a child. They have a child and they are relieved, and they get easily disappointed when they do not succeed. It doesn't mean that you need to be to let's say keep your dream of a second child or a bigger family. Okay, you should seek help, and usually secondary infertility has a very good prognosis. I would say about 10% of our couples come for a second baby when the first was conceived naturally. It's not very common, but it's not uncommon as well.
Mm. Okay, and so basically, just to summarize, then you're saying that that time actually can play quite a big effect on the reasons why you're struggling to conceive the second time. But there are things that can be done. So a proper, just going back to the start and having a thorough test and getting to the bottom of why you can't conceive.
Thorough testing is one step. The second step is flexible treatments, I would say. Not all couples that have a secondary infertility will benefit from IVF. They can have an IUI, an intrauterine insemination, or they have lost focus and they need some monitoring or targeted intercourse. If IVF is necessary, then we need to treat. Any problems have changed. We need also to account for the age factor, which means that we may need to add a few tests later on, such as pre-implantation genetic testing if the woman has gone over 40. This is to help them have a healthy family. Okay. I would say the important step is to have basically a first appointment with a doctor discuss your problem, be open with your problem. This will basically make you feel better, and guidance is very important for the first steps.
Yes. Okay. Fantastic. And then I suppose adding to that, lifestyle factors, taking control of your body, eating better, cutting out drinking and smoking, and all of those things too, that just make your body more receptive to any potential treatment going forwards as well.
Exactly. Well, basically, you describe like this. Most couples that have their first child, then they get loose, they gain some weight, they stop exercising, so they go out of their focus, they go out of their weight. So we need to bring them back to the proper way with a healthy lifestyle, healthy diet with some exercise, and a regular, let's say, a normal body weight. All these things will help the couples proceed to their second child.
Yes. Leading up to my IVF, I stopped drinking. I was so healthy. And then I got pregnant eventually with my IVF babies. And then I got the wine out. And and every night I would finally put the babies to bed and then grab that wine, and that was that was me. And so I never ever, I didn't have any more children, just because for me the struggle was so long, and I got twins, so it was never on the cards for me. But I doubt very much that I would have conceived naturally after that.
This is why we are here, to advise the couples and bring them back to the proper way.
Yes. Yeah. Well, thank you so much for your time today. It's always so brilliant talking to you. You're so clear with your guidance as well, and I just, huge fan here.
Well, it was very nice seeing you too, Sarah. I hope I was helpful. I hope I informed our audience. And if you have any questions, or your couples have any questions, I'm always free to answer them.
Wonderful. Thank you so much. And I'll make sure that underneath our video here, I'll put your details so that people can reach the clinic. Thank you so much.
Good. So